Guys, we're back. So, I didn't record yesterday, but I still studied. I also studied the day before. No, wait, I recorded that. Yeah, it was just yesterday I didn't film. But, that's fine. But, we're locking in. I take the exam in 2 days. It's really like less than 2 days. It's like 1 day and 15 hours or something. But feeling better about it. I took a mock exam yesterday. I paid for one on their website. Kind of expensive. It's $50 for 75 questions and 90 minutes. The real exam is 180 questions and 300 minutes. But that was helpful. I did pass it, which is good. The mock exam, I did pass that. Just barely, though. I just barely scraped by, but I passed. So that put a little bit of a pep in my step. So that's good. Today, I have been studying all day, but I haven't been filming. So I thought I would film now, just because this has become a series now, I guess. And originally, I was filming so that I could motivate myself and hold myself accountable. But now it's just now it's just for fun. So I made a couple more flashcards. So I might look at that. I don't know if I'd film that though. But I found some Quizlets online that are very similar to the VTNE questions that I've been looking at. And I think that's helpful, getting a larger pool of questions that are slightly different than the ones that I've been answering. Kind of broadens your knowledge. So anyways, let's just get into it, right? Probably be quiet for a little bit, but I might talk at some point later. But I've been on a roll with these flashcards on Quizlet, so I'm just going to keep doing that. I'll probably do it till I finish this set of 75 questions in this deck. I'm 5 questions in, so it'll probably take like 20 minutes. Anyways. That's something I need to know. The suture sizes. Definitely need to review that. Butorphanol side effects. Sedation. So, vasoconstrictors are added to local anesthetics to increase the duration of action. So, lidocaine and epinephrine are synergistic. When a patient shows clinical signs of dyspnea and cyanosis, the technician should check for. So cyanosis is lack of oxygen, dyspnea is difficulty breathing. Respiratory obstruction. Okay. An effective drug for treating anaphylaxis is epinephrine. Oh. Atraumatic method of hemostasis. Blotting with gauze sponges. Okay. RBC size. Oh, that's aniso. Microcytosis. Okay. Alcohol. Oh, this is one of those stupid mgs per mil questions. So, normally what you do, 10% solution is 100 mgs per mil. So 825 times 100 is 82,500, so 82 grams. Yeah, I got it right. Good. The neutrophilic segmented cell belongs to the white blood cell. It's a granulated white blood cell. Granulocytic series. Okay, pretty much got that. Fentanyl. Negative. Urine and deer of rats. Zoonotic cattle. Lepto? Yep. A correct statement about vaccines is that they contain antigens. Yep. Which of the following parasite requires an intermediate host? See, these questions don't really work because it doesn't show you the following. True. Overexposed is... Okay. I'm looking up what a glucocorticoid is. It is a natural steroid. A side effect? Oh, yeah, duh. Okay, we knew that. Using a narcotic has analgesia effects. 4 valves of the heart rate are the tricuspid, mitral, there's 6. Okay. Pulmonary and the aortic. Overinflation may cause tissue necrosis, pressure necrosis. The cow may become partially or totally paralyzed with which of the following types of paralysis? After parturition or obturator. Phenothiazine. Yeah, ACE is a phenothiazine and it's a tranquilizer. Phenothiazines are classified as major tranquilizers. Yep. Palpebral reflex is checked at the medial canthus of the eyelid. I just got a Minecraft movie ad on Quizlet. It's kind of crazy that they make you watch ads while you're studying. They'll put an ad anywhere. Protozoa, Giardia, Coccidia, Trichomoniasis. Segmented neutrophil is to phagocytize small particles. If a vial is containing 1 gram of medication, it has to be reconstituted to a 2.5% solution. What volume of diluent is needed? So 1,000 grams, it's 25 mg per ml. So 25, 40. 25 mg per ml. When skeletal muscles are not being used or when they lose their nerve supply, they tend to atrophy. An increase in fibrinogen relative to the other plasma proteins is most likely to be to inflammation. Okay. Cough. Iodine, barium, and air. How many grams of sodium chloride should be dissolved in 1.5 liters of water to make a 12% solution? Okay, so it would be 120 mg per mil. No. Yeah, 120 mg per mil. 12.5. Wait. How do I do this? We need the milligrams. So, if it's going to be 120 mg per mil, there's 150. Yeah, 120. So is it 1,500 times 120 divided by 1,000? It's 180 grams. Yeah. Feels good when you get something right. Cells that line the thoracic, pericardial, and abdominal cavities are known as mesothelial. The standard culture medium used for bacterial assessment is sheep blood agar. Bacterial sensitive testing is Mueller-Hinton, not sheep blood agar. Most likely complication of ET2 cup overinflation, tissue necrosis. For a midline ovariohysterectomy, the patient is positioned in what type of recumbency? Dorsal. When discharging a patient that is wearing a fentanyl patch, instructions of the owner should include proper use and disposal of the patch. Lipase is a pancreatic enzyme that... See, this is what I mean with the flashcards. It's so open-ended. It doesn't give you an option. Multiple choice answer. It just says lipase is a pancreatic enzyme that what? Degrades fat. For horses under anesthesia in lateral recumbency, padding and positioning for important to prevent neuromuscular damage. Atson? Another Minecraft movie ad. Oh, you like my shirt, by the way? It says, I do not think, therefore I do not am. I got it on Etsy and I love it. Okay. I also cleaned my room too. It looks much better. Did laundry. Getting my life together. I feel very monotone right now. But that's kind of a good thing because I'm studying. I don't need to be anything other than that. Okay. Anaphylaxis occurs after the administration of any vaccine or drug. Which drug will best reverse the effect of shock? I say the question and then I have to reread it to understand what it's asking. Best reverse the effect of shock? Reverse of shock. Epinephrine? Okay. Which of the following does not increase radiographic density? KVP. Oh. see. This is another one of those open-ended questions. Produce analgesia except phenothiazines don't have analgesia, which is acepromazine, which we know. Canine. Wolf. Wolf. Prostaglandin. No. Is used for removing subgingival plaque. Scalar. Curette. The old cannon. Elbow. Eight-week-old kitten. Oh, I don't know the dental formula of an eight-week-old kitten. I guess I should write this down. That's stupid. Three, 1, 3, 2. So they don't have any molars, basically. Okay. Treating hypovolemic shock in the canine, the most important form of therapy is to administer IV fluids. Shock is fluids. I meant to click my pen, but I clicked it the other way, and it was already open. I just stabbed myself with the tip of the point. Fluid therapy. Another Minecraft movie ad. A vial of penicillin contains 2 million units of the dry drug. To make the penicillin into a solution that contains 400,000 units per mil, how much diluent is needed? So 400,000 per mil. Five mils. Yep. ET2, of course, is usually performed blind. Inanimate objects contaminated with pathogens are referred to as fomites. Metoclopramide belongs to which class of drugs? Antiemetic. Is that a class? That is a effect. In an anesthetized animal, pale gray mucous membranes are indicative of. In anesthetized, pale gray, poor tissue perfusion. The most profound adverse effect of the opioid drugs. Most profound of opioids. Hypotension? Respiratory depression of opioids. Most common. PT? Agglutination test. And the mare to 3:30. Respiratory acidosis. Okay, we've got 25 still learning flashcards. Breaks down fat. Another ad. What is the advantage of using a narcotic as a pre-med? Prolonged analgesia. Increased analgesia. Which is found in animals most commonly. This is respiratory acidosis. 3, 1, 3, 2. 26. Cyanosis. Respiratory obstruction. Agglutination. Antiemetic. The curette. Fluid therapy. Butorphanol, Pomeranian, collapsed trachea. Caution, side effect is sedation. Profound adverse effect of opioid drugs is respiratory depression. Another ad. Poor tissue perfusion. Luminizing. The Mueller-Hinton. Yeah, that's what I thought it was. For the inhibition of antibiotics. Okay. After parturition, this is obturator. Five-aught is the smallest. Another freaking ad. That's crazy. You have to pay for an ad-free study experience. It used to not be like that, like literally a year ago. Microcytosis. Inflammation for fibrinogen. Increase in fibrinogen to relative to the other plasma proteins is probably from inflammation. Lead poisoning, basophilic stippling of RBCs. That's a characteristic. Done. I think that's